Good afternoon. So for today's update, there's a couple of things we want to do. First, to give you the new cases and the new totals that we have in the province. And then we're going to talk a little bit about what this means and some of the data that we're using to drive and to understand what's happening in our community. So to start with, we have 74 new test positive cases today, giving us a total of 424 people in our province who have tested positive for this disease. That is 230 in Vancouver Coastal Health, 126 in Fraser Health, 37 on Vancouver Island, 27 in Interior Health, and we remain at 4 people in Northern Health. In addition, we have had 5 new cases admitted to hospital for a total of 27, and of those, 12 people are in ICU, and 6 have recovered. We have 1 additional death related to the Lynn Valley Care Centre, bringing our total to 10. On a positive note, we've had the person who was hospitalized at one of our long-term care homes is now out of hospital, which is good news. And we have a number of increases in staff, increased by 1 in the residents and staff at Lynn Valley Care Centre who have tested positive. I think this tells us again that we have risk around the province and how important it is for us to pay attention to what's happening in our community and take those measures that we have been talking about all along. So this is not only confined to hospitals, to our healthcare sector, it's also in our communities, and the actions that we are taking today make a difference in how we can transfer this disease to others. As well, I am issuing a new order today, effective today. I'm now ordering that personal service establishments must close until further notice, as these require direct personal contact with other people, and that is impossible to deliver while maintaining appropriate distance. So these are things like salons, spas, massage parlors, tattoo shops, etc. And I know most of these businesses have closed, but it's come to my attention that there is still confusion out there about whether they should be open or not. So we want to make it very clear that the expectation is that these will be closed. So I'm going to give us a little bit of a look, if we can put up the slide. We've talked quite a bit about what we do in public health and about epidemiology. And epidemiology is the study of the who, what, where, and when of diseases, and it's about tracking the disease and helping us understand what's going on with it. So we track 2 curves. And what we have been talking about here, for the most part, is the number of people who have tested positive on a given day. So the numbers that I gave out today, for example, were the positive tests that came out of our lab over the last 24 hours. And so that is this curve here. I guess I need to, okay. That is this curve there. If we look at what has happened since the beginning of January, and the 15th of January, we had our first case. The dark blue represents the cases plotted on what we call an epicurve by their onset of illness. So there's 2 things that we're looking at. What you are receiving every day, what we have been giving out, is the number of people who test positive. Those people are people who have been identified by public health as having a risk, having an exposure. They get a test. Sometimes it takes several days before that happens. So when somebody gets sick, there'll be some time before they recognize it sometimes, and that's one of the challenges that we've had with this disease, that people may go to work, may interact with others before they realize they're sick. At some point, they realize they're sick. They may see their healthcare provider. They may go to one of our assessment centers now, and they get a test. And it takes sometimes several days for those tests to come back. In the meantime, public health is doing their investigation, the detailed investigation. And as we talked about from the beginning of this, we did very detailed investigations on all of our initial cases where people who were imported from other places. And we find out when people's symptoms start, because that helps us understand where their exposure might be. And with this disease, we know the incubation period is up to 14 days. So we meticulously track everywhere that they had been in those 14 days and determine if there are other people that were exposed, and we keep those people in isolation to see if they develop symptoms, so that if and when they develop symptoms, they're not passing it on to others. So the curves that we're watching very carefully are the dark blue. And this is our epi curve by onset of illness. And this is the one that we will start to see decrease if all of the measures that we're taking are effective. So when we talk about flattening the curve, it's not necessarily the tests per day that is important. It's the number of people getting infected and making sure that we can look back at those days ahead and isolate people before they can transmit it to others. So this affects, this is why we have put in some of these drastic measures that we've been talking about around social distancing. The social distancing, the physical distancing from people is what helps us not transmit this infection between us. And this is incredibly important right now for everybody. We know that we've had community cases for a couple of weeks now. We know that people in the community are transmitting it to each other, and that is leading to the outbreaks that we've been seeing in long-term care homes, in hospitals. It means that healthcare workers are getting infected. They're getting infected in the community and then bringing it into work in some cases, or transmitting it between each other and between their families. These are important things that we can affect now. I think, all right, we'll go to one other. I also wanted to give you an idea of what we've been following in terms of the ages of people who are affected here in British Columbia. And what we have in the dark lines are the proportion in our population that are in that age group. And what we have in the lighter lines are the number of people that have tested positive for this disease. And as you can see, there's more people in the older age group. We have very few people in the age 10 to 19, so young people. We have nobody under the age of 10 at the moment who's infected with this disease. We have a cluster, a group of people in their 30s to 40s, and that mostly reflects healthcare workers who are involved with our clusters. It also represents up to 20 people now that have been associated with the dental conference that happened a few weeks ago here in BC. So those tend to be younger, healthier people. But we also have a skew to the older people. And again, that represents the severity of this disease in older people and the outbreaks that we're seeing in our long-term care homes. So we will be posting this information on a regular basis over the next coming weeks so that you can have a look at this as well and understand how we're doing at making that epidemic curve flatten out and lengthen out so that we're best able to take care of everybody in our healthcare system. This is our chance to alter the course of this epidemic, and we can do it. We have seen that it is effective in other countries if we all do our part. It's in our hands right now. So this is our chance to stay apart, to connect socially, to connect virtually, to support each other, but to physically distance. And I'm calling on all of you to do that right now.